We would like to invite now Joanna Witczek, CEO and co-founder of Gotsi Health. Joanna, you're welcome. Also, Maria Korchevich, Deputy Minister of Health with Ukraine for Digital Development, Digital Transformation, and Digitalization. Welcome. Victor Dosenko, pathophysiologist, geneticist, Doctor of Medical Sciences, Professor of Kyiv Academic University, Head of Development and Innovation Department of Lab. Kirill Honcharuk, CEO and co-founder of CheckEye. So we thank you for being with us. Mikhail Radutsky, Head of the Verkhovna Rada Committee on National Health, Medical Care and Medical Insurance. And the moderator of the discussion panel will be Inna Maslinchuk, MedTech Biotech Lead at Win-Win. Welcome. First of all, I would like to thank everyone who were patient enough to wait for this panel. And we would like to offer to you during the next 45 minutes to get plunged in the sphere of the medical innovations. We are used to talk about the Ukrainian medicine using language of renovation of hospitals, system of data, registers, services. But today actually dictates some different conditions to us in development of medical innovations. We are talking about ambitions at the national level. And we have to offer some new model when the innovations are born, not against, but owing to the what is going on. We have two representatives of startups, one a foreign one from Great Britain, another Ukrainian startup. They practically work in Ukraine today to test a new solution. They have to pass through the same regulatory, bureaucratic path like the big pharma producers of the medicines do. Our regulatory field is more adapted for the big players and not for the smaller agile teams or for startups. But why Ukraine is unique? Because first of all, we have such a unique combination of things, which is especially the global map. First of all, we are talking about digital state. We're talking about a lot about that today. An electronic system of healthcare, medical system which requires innovations in new technologies, which are being effectively tested even under conditions of war. This is not the issue whether this is ambition or some kind of toy. This is the issue of our survival efficiency and the effectiveness of the healthcare, and the war became the trigger, the booster for medical innovations experiments. What we plan to do with the Minister of Health within the framework of Win-Win, together with Ministry of Digital Development, the sandboxes. This is the state initiative, which is not just a format of state sandbox for the rapid testing in the controlled environment under the control of regulator, but this is mechanism for the testing of the medical breakthrough, which is tested under this big framework or umbrella in Great Britain, in Spain, in big countries. And this model actually enabled us to do things safer, more safe, and faster. So those sandbox will allow the medical startups to develop their ideas to test the fast certification, also assessment of medical technologies. Actually, today, as part of our panel, when we are talking about the building of this ecosystem, which will enable us to test the solutions in different technologies, we actually selected, I would put it this way, the key players which will allow us to do that efficiently and effectively. Win-Win is not just the global innovative strategy. This strategy of cooperation and partnership between industry and science and the state. So each our speaker, they position what we are talking about, the efficient interaction. Marie Karchevich, which actually formed a digital foundation of the healthcare, without which we cannot talk about any innovation. Mr. Mikhail Radutsky, who actually takes care of the legislative architecture, which not only will allow us to have innovations, but also open the country for something where we actually, on which we work in win-win very actively. Viktor Desenko means science, translation, innovations, without which we cannot imagine innovations which can change our life and the world. Kirill Druk, this is the voice of the AI in the sphere of the healthcare, innovation, these solutions. This is an example how Ukrainian becomes, when we can actually save the funds at the stage of the early revealing of diseases. And our next participant shows the international view, how the world views Ukraine, how we can actually implement the global decisions or solution to our system. So let's start with the policy in the healthcare, without which we cannot effectively introduce or deploy the innovations. So first question goes to Maria Kinsevich. Also speaking, in Ukraine, there is a great demand for technologies in the sphere of medicine. Well, at the same time, war demonstrated our bottlenecks, the weakest points, what we consider the lack of the doctors in small communities, the lack of access to the rapid diagnostics. We are talking about the support of the mental health of Ukraine during the war. And since the full-scale war started, Ukraine made a lot of steps how to improve the situation. But we do understand, without the business, without technologies and innovations, we cannot do take care of qualitative leap. We are talking about technology. So my question is, the important development of the system, what will give us? This is some kind of ambition, or we're talking about the economy or the resilience of the health care system, or we are talking about new services for the people, for the citizens. First of all, I would like to say that I'm glad to be part of this inspired and creative people who really want to make our country more powerful, more strong and better. We know that we live in the world which changes rapidly, and we do going through the events which about a decade or 2 decades ago we could not even imagine. And the world changes so rapidly that the traditional approaches we used to entertain before, they become not so efficient or not so effective. For the medical sphere, the first challenge we met was the COVID-19 pandemic, not only for the medical sphere, but to the whole world as a whole. Also, we have another challenge. I'm talking about the full-scale war in Ukraine, and indeed, it revealed the things and challenges which we let's say have in the medical sphere. Lack of the personnel, lack of access to medical services, medical infrastructure. Just to give an example, a small figure, the damage, the harm done to our medical institutions during the full-scale war, the Russian Federation damaged, or let's say eradicated more than 4,000 different medical institutions. This actually impacts the accessibility to medical services. That's why innovations, if you're talking about those, we are talking about the search for the solutions, how we can become more efficient, more effective. Innovations mean how we can make our country more capable, more competitive. And this, owing to new technologies, we can improve the quality of life and the effectiveness of the medical assistance provided. We can do that people can recover faster, and we actually can extend the term of life or the longevity. if you're talking about we are talking about the creation of new jobs. This affects the economic growth, generally speaking. Recently, I read the comment of the laureates of the winners of Nobel Prize and the economists. They say that innovation is the basis for economic growth in many countries, and they actually introduce such a principle as the creative ruination. When the companies which create innovation, they actually replace those companies which offer traditional approaches. For our country to be strong and capable, we need innovations in the medical sphere. This is our objective. And definitely, if we follow the philosophy of win-win, it's very important for the country to be not only the regulators we traditionally used to think. The state must be a partner and stimulate the development of innovations in our country. Thank you, Maria. Actually, you covered already my next question. I'm going to miss that and immediately go to a more painful question of trust towards innovation, especially we are talking about medical community. Today, we have here the managers of some of the medical institutions who actually they are for the innovations, but unfortunately not all of their colleagues are for that. We have a very fragile system. Well, we have a system who can support this fund, but what we lack to create the necessary trust between the business and government and medical officers, if you're talking about innovations, to make us move faster for the hospitals to use those innovations. What is your vision? It seems to me that on the one hand, such change in the philosophy of thinking and philosophy of interaction, because all of us we are used that the state is the regulator or arbiter or the judge. They determine the rules and regulations, and the market has to follow those rules and regulations. If we are talking about innovations, we need a different environment. When not only the state determines the rules, but when the state stimulates the development of new technologies and new solutions. So the number one is new thinking philosophy. And for us, it could be reflected also, among other things, in the solutions decisions which we are preparing, MedTech Sandbox, to unite the environment of science and business and medical institutions so that we can quickly test and try the newest solutions, how much effective they are, and how we can scale them to have a positive assessment. It's clear that the medical institutions and medics are very careful when talking about innovations. We have some pilot projects for using the AI. And the second aspect I'm going to talk about, in order for the medical officer to trust those solutions, it must be a high quality one. Also, in addition to stimulate innovation, the state has to ensure the balance between the let's say the rapidness of development and the quality and the safety for our patients and clients. And those two aspects are very important. I mean, their combination to a very productive and high quality medical officer to trust such products, because in medical sphere they pass the decisions which affect not only the health but also the life of the patients. We have to ensure that this is done properly. I agree with you. The sandbox is to accumulate all the data, especially if you're talking about the advocate. We are talking about the pressure on the community, especially in using AI in medicine. Thank you for your perspective. We are going to switch over to the legislative aspect. You have a representative of the parliament, Mikhail Radutsky. Do you feel the preparedness of the parliament to support such approaches when not only you establish the rules and regulations, but you help the innovative business to develop their activity in Ukraine, to test their developments or their products? based on the established rules, as I mentioned before. Is there anything like that in the legislative level, what you're working on now? You know, perhaps I won't be a very objective speaker today because I am personally is a fan of the use of the AI, first of all, in the medical sphere. Maybe some of the things I'm going to voice, maybe this will be what I desire, not the real. But I really wish the AI occupied the first places in Ukraine, not the last ones. When the world leads away, and the Ukraine only waits to be somewhere in the end of the line, you know, to use those. As I mentioned, maybe I'm not very much objective because I'm a real fan of the AI. Speaking about the preparedness of the parliament, you know, I would like to start with a different thing. For some reason, our society, sometimes it's they have grounds for that. When they are talking about some kind of regulation, they say set of some rules or prohibitions, bans. In our committee, we're not talking about some kind of prejudice, but about the development. But you have to understand that I believe that developers who are here in this audience, they know that the COVID, according to the conservative views, the first place, the doctors occupy the first place among other specialists and experts. And you can explain that because the doctor, unlike other experts, he is responsible not only for the health, but for the life of the patient. And the doctor's mistake, unlike the engineer's mistake, costs a lot because there is no more costly than the life of a person or a human being. Unfortunately, not everybody in the world understands that, and Ukraine knows that better than anyone else. But without regulation medicine, we cannot move. In our committee, we have a more simple approach because for the first time in the history of independent Ukraine, perhaps Maria will support me in that the Verkhovna Rada Committee and the Ministry of Health, for the first time ever in history of Ukraine, independent Ukraine is not antagonist. And those people who are close to the medicine, they know about the relationship between the committee and the Verkhovna Rada and the Ministry of Health. Many of you know about that, right? Today, it seems to us that we stepped over this history. We are not arguing who is the most important here. Today, I always say why we have to follow in somebody's steps. Why the Great Britain, which is very regulated, very conservative country, has their own sandbox, which gives a chance to startups to test and prove their results, their outcome. Why Germany made an exception from their legislation when during the year they allow in some kind of invention using the AI, they allow during the year to prove its need or its necessity. After that, maybe a startup will demonstrate, I'm sorry, this is something different. Or they continue to work along those lines in the country. I believe that Ukraine will follow in those steps when the parliament will support that. Let's put it this way. I'm not talking about myself. I'm talking about the composition of our parliament. This is the youngest in the whole history of independent Ukraine. Young people understand that they were allowed to live in this society, and I believe that such things will come to its logical end. Maybe Maria doesn't know, but for the second month now, I've been trying to persuade Vice Prime Minister Fedorov and Minister Leshko, and I believe that the first deputy minister who is responsible for the procurement to become the person who will be AI. Albania actually gave this post to the minister, but Ukraine is not Albania. But whenever Mr. Fedorov has time, I always continue to talk about the launching of this project in Ukraine. Again, I mentioned the first deputy. Why? Because none of the AI can replace a doctor. it has to help the doctor. AI, I mean, must be assistant to the doctor, but for sure it cannot replace the doctor because the doctor bears the responsibility. AI responsibility is only conventional, conditional. You know, I failed to do that, but the doctor has a different story. It's a different story. I can say that Ukraine is lagging behind because in the rural medicine we use AI. This is the Finnish program of AI program, which decodes the ECG. Many doctors left the country. Many people left the country, including the doctors and physicians. And we lack the doctors in Ukraine. For the first time ever in my life, I can say that the competition for the medical university is less than one person per vacancy. It has never been the case before. If somebody does want to have AI, we are forced to address the AI and use it to assist, to help the doctors. And these hospitals will already use the AI program, which diagnoses the problems associated with the human brain. And the statistical outcome results, I'm not prepared to give you exact figure, but according to statistics, which is more or less accurate science, according to statistics, the effectiveness of the diagnostic and of some of the areas of the brain is rather high. And I know that there are some people who are involved in the development. I heard Maria, what she mentioned. We are prepared to do that. We are waiting for something, for your inventions to be used or to be applied, and so that you are not restricted artificially in your activity. And the Minister of Health and our committee and the level of the bylaws has to do something about that. We never believed that electronic, let's say, prescription can work, but we can't imagine our life without electronic prescriptions. In Pentagon, they actually ran to me to see my phone with the DIA project, and had that plastic. And I showed that in the DIA, and the generals in Pentagon said, can't be so in Ukraine. We cannot do that, but Ukraine has all the grounds to demonstrate to the world how it takes place, and how it happens in Ukraine. Thank you very much for your prospects. Together with the Minister of Health, we're going to propose the necessary decisions. Maybe we reach the stage when we will have to sign the regulatory documents for some cool decisions will be done by AI, who is going to be Deputy Minister of Health. Deputy Minister of Health. But the idea regarding the procurement, yes, indeed, this really already works in Albania. It's a good idea. Now let's plunge into the prospects of our science, because each innovation starts with the products, and products can't appear from nowhere. It has to be developed in the laboratory. If we're talking about medtech, or tech, whatever decisions or solutions. When we give birth to something new, some innovation, or some, let's say, but behind that stand not only developers with technical, let's say, vision, but others as well. How the science can become not just onlooker or observer. Unfortunately, we have such a trend in Ukraine, but also a driver of the innovations and in a resilient manner to change the situation. My question to you, Victor, you are well-known representatives of science and special technologies, and heard a lot of times that one of the many researchers who remained in Ukraine is you. So in your opinion, speaking about Ukrainian scientific medical science, I'm talking about how to switch over to the science of products so that the science could cultivate innovations which can really affect the life of people. Thank you. First of all, I'm talking about some of the publications. I'm not going to allow This is really, I mean, we have to respect the real publications, because the real publications behind this is this the scientists become a real scientist if he has publications on scientific research journals. Well, I'm not going to offend anybody or any city, but in each city we have some of the universities. If you just publish your pieces of work only in those universities, it's not. It's not worthwhile to hope that such a scientist or researcher will do something. And honestly speaking, we have 90% such scientists who call themselves the assistants professor or professors. They do not have publications in serious journals. And this is there would be a revolutionary step of Ukraine to recognize that this specific researcher, scientist, scholar publishes his works only in this level. We actually are talking about using somebody else's innovations for guitarism, the people who create a new knowledge. He doesn't have to copy somebody else because somebody did something before, something like that before. And such people are just a few. And we have to provide finances for such people. Where to take those finances or funds? Alexander Dugin understands what is what here. I'm a new head of the Department of Innovations, and we actually had some of the publications of USSD during the first and second quarter. But those businessmen who would like to have to know this notion, first and second quarter, 25% and the next 25% in a certain sphere of medicine, 25 publications during the half a year, and none of university showed such results. Next question is how many billions were EU or the state funds were used, and how much the state spent? Zero. They paid a lot of taxes, and they provided high quality services based on innovation, etc., etc. So you want. If the entrepreneurs have science, they provide the R&D departments, his own laboratories, introduce it. And he creates such innovation because of those 24 publications is not vanish in the thin air. They were driven by medical experts who on a daily basis actually diagnose Ukrainian citizens. This is some correct thing to do. This means they are moving towards a new sphere.
I have a question related to it. You compare publication made by medical universities funded by the state and a private entity. And yes, we have at the legislative level this process, the PPPs, known as that. Is it possible now in Ukraine and European, because legislatively speaking, everything seems to be regulated. But what about fact? Is Ukraine ready to present a mode of translational medicine when something is transferred from lab to production, to practice? So research institutions, they're in the same pool, but then they can be in the same ecosystem and symbiosis. I'll be boasting of it, but Krovos Pass is the hemorrhage preventing thing. Instead of bandages, we did that without a penny of investment. Then we got grants from the state, but that things supported by the state are not manufactured by anything, but by anybody. But the commercially developed ones, this is the hemorrhage stopping kind of means, because usually people die of hemorrhage. We have to stop hemorrhage. It's good to have a tourniquet, but it is not always available. So we have the Ukrainian analog to detonator preparation or drug, and now we have this big war raging, and everyone is discussing PTSD. We have to look into it to develop new techniques of diagnostics, the biomarkers, and new, more effective techniques for therapy. Alexander Dudin created the research center. Alexander Dudin is manager of this whole business. Not everyone is aware of that, but every responsible business person does it. Seeing the problem and what the government need to do is not to give any advantage for the private business sake, but you should not exclude private entities. It's PPP in action. If the grants are for science, medical science, or whatever, well, we had this Ministry of Healthcare competition, but private entities are not eligible to apply. So it's just the governmental. So it is very important to resuscitate and revive governmental entities. No, this is not the case. We have to find people who are still very much alive and kicking, who are quoted, who are published in the most important medical editions, medical journals, and they participate in the editorial of some magazine and some conference presentation. This is done easily for a small pay. This kind of publication is devaluates. This is not an ideal factor, but this is the most informative, and I would like to call upon the National Research Fund and Ministry of Education and Science and Ministry of Healthcare to support this approach with the distribution of public funds. And where those people are employed in public or private entities, it doesn't make any difference, in my opinion. This is for the sake of our state, whatever the origin. The prospects of science are complicated, and we have, I think I was simplifying, actually. It is very simple. We have to downsize the number of scientists that need funding. 90% of them are not evidence-based, so we do not have to buy from them or them, for that matter. So the 10% surviving, they are the cream. And I personally believe, I think this belief is shared by some people here, that science and startups can create some bifurcation or synergy. So let's dive into the prospect of a Ukrainian startup, quite effective, quite successful. Cyril, your startup in the sphere, this is the first line, medical assistance. You have to deal with the first line, family doctors. Can we provide some relief for them and help them pay more attention to patients? And also, this is about economizing. This is about saving the scarce funds. Yes, AI is developing. Well, the most popular application is when it becomes an additional instrument for nurses and medical doctors. And thanks to AI, people can develop the skills within hours that originally needed years to hone. And within a day you can master a technology that takes years for traditional ophthalmology, ophthalmological training. And like Mihailo said, this is application of AI for the rural areas, for the first line, to identify chronic diseases or other conditions in an easy and accessible and affordable way. And we can tell that 75% of the diabetes-related costs are related to the conditions that can be easily diagnosed and identified at the early stages, complications before any symptomatic manifestations. People do not discern the problem, but it is the most effective stage for diagnostic, cost-wise and effort-wise, in terms of prevention of disability or any kind of the life expectancy and a healthy life expectancy. How much can we expect to save for the government? Because chronic diseases, they consume the biggest chunks of the budget. The specialized link in this chain. How much can we save with AI? I'm not prepared to give you any final figures, but from the point of view of relative estimates, recently we had that publication in Health in Ukraine. This is the medical journal analyzing different complications of diabetes, prevented, saved, per one invested $1,000 in treatment. This is something that has been already established. And Joanna, who is founder of AI startup in Britain, but this technology helps with the very complicated infections which are antibiotic resistant, and the company created this system, and with the help of AI they can find the bacteria and destroy. In the very focus of infection, and we have signed this cooperation memorandum, and Ukraine is the first country in Ukraine to FAG therapy, for the FAG therapy. As we really work a lot on such products appearing in Ukraine. Unfortunately, we have very little time left. But Jan, can you tell us about the prospects of the global technology in Ukraine? Because, in your opinion, can the world actually trust in the evidence generated here, and what we have to do, the government, the ecosystem, the R&D, to maintain this reputation, for it to proceed with flying colors and be trusted?
Position, because due to the war challenge, there's a lot of medical challenges, but every coin has two sides. There's an opportunity that we can grasp here, or Ukrainians can grasp here. So the challenge of antibiotic-resistant infections is not just unique to Ukraine, it is unique to United Kingdom, to many other countries in Europe. It's a global problem, recognized everywhere, but maybe it's not at the same scale. maybe there's not the same urgency, but it's an opportunity because there is urgency here. We can create solutions that have global reach and global potential. And that's what Ukrainians can focus on. It's an opportunity to accelerate medical development, potentially when available and when fitted through accelerated clinical pathways or military pathways. Not always possible, but where possible to not compromise the technology. But what is critical in settings like where we are, where there is urgency which doesn't exist in other countries, there is a will. And also in Ukraine, you already have a talent. There's plenty of people with skills. You've demonstrated how innovative you can be in the defense. The ecosystem is here. And I think the next sector is healthcare, where the potential is one of probably the biggest, and really that can be transposed into other countries. And the connectivity, the speed at which people can work, in other countries it takes half a year to set up a collaborations. The fact that people want to work together, that there's urgency, that there's need, that everyone's coming together to solve it, that brings new technologies at an accelerated speed, which is a huge potential here now.
Дуже дякую, Джоанно. Ми дійсно дуже багато.
Joanne, and we are working in that area. Indeed, such startups as yours are welcome in Ukraine. We would like you to answer, but one crowning question for each speaker, for each panelist to answer. What would be your advice for a young person starting their medical enterprise in Ukraine? Joanna, please.
I think the opportunity is huge. I think the biggest one is just talking to people and starting working, and also not being afraid to reaching out to people abroad and bringing them in. Like we are here, we are very open to talking to people, to sharing experiences, training people, setting up the ecosystem. So I think the community is key, and you have a great community. And the innovation ecosystem that started on the defense can be transposed into healthcare quite quickly. It's all about training the talent and making people believe that it's possible, and it's possible to do it quickly.
Thank you so much. Victor?
Victor, science provides 100% of result. Startups, 90%, about 98%, that's the world experience, produce no result. We start with the science, and that's how we can include startups, medical startups. Please apply to Victor Dosenko for scientific advice, academic advice. My advice is not that conventional without any scientific articles. Don't listen to anyone. Take no heed. They will take you into account. Not everyone. There are more people turning a blind eye but there are two addresses. This is the Ministry of Healthcare, the Ministry of Digital Transformation. They will listen to you. Full stop. Don't sit on your hands. It is all in demand, and much more in Ukraine, twice or thrice more than in any other country. Very motivated. Cyril. Let me speak as a follow-up. Don't give up, and if you knock long enough, you'll be heard, and the door will be opened. Maria, don't be afraid to take this risk. There's no pain, no gain, and people should think about some solutions, some way. Where there's a will, there's a way, as we say. So Anatoly, and then I enthusiasts would be glad to hear that we are now developing medical assistant, AI assistant. So please dare, please try new things, and we can take the lead in the world. Thank you very much for your discussion. Thanks for joining us.